Welcome to my YouTube channel. Today, I wanted to discuss about a special cause of constipation in this very short video. Typically, they will come to my office and will tell me, Doctor, I'm eating really well. I take a lot of fiber, a lot of vegetable. I'm taking all the laxatives over the counter possible. However, I'm very distressed. My belly is distended, bloated every day. What can I do? What can you do? When such a patient comes to me in the initial consultation, I do sit down with them. I do take a good history and physical exam in order for determining that they have no organic cause of obstruction. By organic cause in medicine, we mean a real disease like a colon cancer or diverticulitis or a stricture or narrowing of the colon or various other diseases. Once I rule out all of these conditions, after taking the history, physical examination, once such serious causes are ruled out, the reason for constipation is quite evident. The problem is what I call empty colon syndrome, or in other words, in literature, it is described as laxative overuse. For example, human colon is a long organ, about 4 to 6 feet long. Normally, when we move our bowel, we only empty out the last 1/3 of our colon. 2/3 of our colon is supposed to be full of stool. In fact, to the extent that this excreta, feces or stool, and our colon and colon lining have evolved together, it is important that 2/3 of the colon should have stool material because the cells, the lining of the colon that we call colonocytes, actually derive their nutrition. In addition to that, we also derive, although a small amount of nutrition from colonic fermentation. So it's important that those chemicals, for example, butyrate, stays in there, which is healthy for colon. When people overuse laxative, what happens is that their colon completely empties out. So if their colon does not have any stool material, people are not going to move their bowel for a couple of days. It is neurological reflux. And at that time, what happens if they don't move their bowel after laxative use for a couple of days because of the empty colon? These people get more anxious and then they take more laxative that pushes out the small amount of stool that is left in the colon and thus making the colon even more empty, and then they go to a vicious cycle. It's like chasing the tail but never getting hold of the head. So they get more and more concerned, and thus the cycle of constipation continues. So in conclusion, laxative overuse and thus making the colon empty by itself can give rise to constipation. It is not a true constipation. It's a constipation because the colon didn't have enough filling time. Colon needs to be full before we can have a regular bowel movement and a normal defecation or bowel movement reflex. So how do I treat this? I sit down with the patient. I have a long, good and hard discussion. I educate the patient about our colon, how it works and what it is supposed to. And I advise patients to discontinue all the remedies, all the folk medicines or over-the-counter medicine they're taking for moving their bowel, and to eat their food in a nice, balanced way, as well as keeping their hydration. And if there is any other associated disease or medicine is contributing to that, also that needs to be addressed. In general, most of the patients get a wonderful response. They come back to me saying that, wow, I didn't know that if I use too much laxative, that itself can give me constipation. So folks, don't forget to subscribe and like so I can give you more of this kind of educational materials about your gastrointestinal health, by which we can keep ourselves happy and healthy. You guys take care. See you next time.